Hello, everybody. I think we're going to wait just a minute here to get started until my clock turns all the way to noon. We'll get started right at 12 o'clock. I want to welcome folks. All right, well, we'll get started. Hi, I want to welcome everyone to this edition of People's Communities Clinic's Lunch and Learn series. I'm Dr. Louis Appel, Chief Medical Officer and Director of Pediatrics at PCC. I'm going to go ahead and take my mask off. We are wearing masks at the clinic all the time, all of our staff, because I'm in a room by myself and I'm not around other folks here. I'm going to go and take this off because the microphone will pick up better and I won't fog up my glasses, and I'll be able to see a little bit better and talk to folks a little bit better. So again, I'm Dr. Louis Appel. I'm Chief Medical Officer and Director of Pediatrics at People's Community Clinic. Today, I'm going to be talking about COVID-19 in children and also a little bit about the upcoming vaccines to prevent COVID-19. So I'm going to talk for about 20 minutes and then we'll have some opportunity for questions. So first, I want to be clear with everybody that I'm not an expert specialist in COVID-19, but over these months of the pandemic, helping to navigate the clinic through the pandemic and treating patients at the clinic, I've learned a lot, both through reading, attending virtual lectures and discussions, and talking to a lot of folks, all trying to keep up with the latest information so we can provide the best possible care to our patients here at the clinic. So I'm going to share with you some of that information today, particularly related to kids and the vaccines. So we'll start here with the basics. So what is COVID-19? So COVID-19 stands for Coronavirus Disease 2019, and it's the illness that's caused by a virus called the Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. So COVID-19 is the disease and SARS-CoV-2 is the virus that causes it. So you may hear people reference both of those. For the purposes of today's talk, I'm just going to use COVID interchangeably for the disease and the virus just to keep it a little bit simpler. So let's talk about COVID and children. So over the course of the pandemic, there's been a lot of different information out there that's floated around about COVID in children. So you may have heard information along the lines of kids don't get COVID or kids don't get very sick from COVID. So what's the actual situation? So first, I want to be clear, kids do get COVID, children do get COVID. As of a week ago, last Thursday, which is the latest data that I've got, over 1.4 million children had tested positive for COVID in the United States. And of those 1.4 million cases, 124,000 had occurred just in the prior week. So those numbers have been going up rapidly. So in the last few weeks that there's reported data for, the number of cases has gone up about 25% compared to the total cases previously. So the numbers have been going up rapidly as things spike and surge across the country. Here in Central Texas, over 5,400 children have tested positive for COVID. And here at PCC, we've had almost 100 kids test positive for COVID directly here at the clinic. So the second point I want to make is that kids do get sick from COVID, but it does appear that most children have relatively mild or moderate illness, and it's rare for children to need to go to the hospital or die from COVID compared to higher risk adults. So the American Academy of Pediatrics has worked to collect and summarize data from the states, for the states that do report hospital data with age information and everything. And from what they've been able to collect, looks like only about 1% to 3% of all the hospitalizations for COVID are in kids. Or if you look at it a different way, out of all the cases of COVID in children, only about somewhere between 1% and 5% of the cases of COVID result in a hospitalization. And depending on the state that you look at, anywhere from 0% of the COVID cases in children to 0.1% of the COVID cases in children have resulted in death. So severe illness does occur in kids, but it does appear to be rare. So that's good to know. As with adults, racial and ethnic minorities appear to be disproportionately affected, and that likely has a lot to do with the various social determinants of health that impact folks, families where the caregivers need to work on the front lines, don't have the option to work remotely, underlying health conditions, inability to isolate, having to share homes with extended family, those types of things. So a third thing that comes up related to kids in COVID frequently is around whether kids can spread COVID. And they can. So children definitely can spread COVID. It's not entirely clear if they spread it as efficiently as adults, but there have been studies that show that the viral loads, the amount of virus that's actually in kids' nasal passages is as high or higher than that in adults. And it appears that adolescents can spread COVID at least as well as adults, and even young kids can spread COVID. So there are definitely plenty of reports of COVID spreading from kids to adults, as well as from kids to other kids. And so from a practical standpoint, even though we don't know exactly how well kids spread COVID compared to adults, they definitely spread it, and that's the most important thing to know. So how about symptoms in children? So overall in children, we see a lot of different symptoms as we do with adults, and some folks can have no symptoms. What we see in kids is pretty similar to what we see in adults. Fever and cough or shortness of breath are the most common things, which is similar to adults. We do see headaches, muscle aches, and sore throat in kids, especially preteens and teens. Those symptoms seem to be a bit more prominent. Things like diarrhea are less common, nausea and vomiting, just a runny nose, abdominal pain, fatigue, those things also seem to be less prominent in kids, but do occur. And then loss of taste or smell does not happen frequently with kids, but when it does, it's specific, and it definitely is a red flag for us that the person may have COVID, whether that's an adult or a child. So those are the basic kind of symptom pieces. In terms of recovery from COVID, like I mentioned, most children do seem to have mild or moderate disease, and many even have no symptoms. For kids that do have symptoms, they usually recover within 1 to 2 weeks of onset. That's similar to what we see with adults. In terms of long-term kind of effects, with adults, there has been a fair amount about what some people call COVID long haulers. So folks who have for months after their initial illness have problems with lingering kind of symptoms, especially things like fatigue and shortness of breath and trouble concentrating and thinking, depression, those types of things. And in kids, we don't really know the frequency with which those kinds of lingering symptoms occur. But they do seem to, but they definitely do occur. So there definitely are reports of that, but we don't know how common that occurs. And just a reminder, you can submit questions, and at the end we will have some time for questions. And so in the chat at the bottom, please continue to submit questions for us, and we'll have some time for those. So people may have some questions about a disease or a condition that you may have heard about that kids sometimes get with COVID that can be really serious. So there is a condition that's been named the multi-system inflammatory syndrome in children, or MISC, that is rare but serious, and that does seem to be associated with COVID. Because it is rare, we don't have a lot of information about it. It's a condition that seems to occur 3 to 4 weeks after the original illness. So some people think that it may be related to our immune response to being sick with COVID. It includes persistent ongoing fevers for 3 to 5 days or more. Gastrointestinal symptoms seem to be pretty prominent with it: abdominal pain, vomiting, and diarrhea. People can get a rash, people can get conjunctivitis, red eye, headache, lethargy, confusion. And a big thing with it is inflammation in different parts of the body. Particularly, there can be inflammation in the heart muscle. There can be low blood pressure. There are lab tests that show inflammation across the body. Most of the cases of this have been in older children and in adults. Most children do survive having MIS-C, but there have been some deaths associated with it. In one series of cases, they found a death rate of about 1.7% for children who did get MIS-C. So it's something that we really want to monitor for in kids who've had COVID. And typically they are in the hospital to be monitored and stuff for that if they do develop MIS-C. But again, it's rare, does not happen frequently, but it is something that we're on the lookout for when kids have COVID. So I want to touch on testing for COVID real briefly. Testing for children is really the same as it is for adults. So there are different kinds of tests that you can have for COVID. There are what we call molecular or PCR tests that look for the actual genetic material from the virus. Those tend to be more sensitive in picking up cases. Then there are another category of tests that you may hear referred to as antigen tests. Those look for parts of the virus shell or the protein of the virus. Both are used to diagnose COVID. And there are different ways to collect the samples. So this is from a practical standpoint, what people sometimes are most interested in. So folks are probably familiar with the nasopharyngeal swab. That's the one that goes in the nose and goes all the way to the back. Then there are nasal swabs that are either from the very front of the nose or a little bit sort of to the mid part of the nose that are more comfortable. There are also oral swabs that can be done for COVID. That's less commonly seen. And then there are saliva tests as well. Most of the tests that you'll get at clinics and places are some kind of nasal or nasopharyngeal swab. The recommendations for children around isolation, if a child has COVID or has the symptoms of COVID and doesn't get tested, the recommendations for isolation are the same as they are for adults. That's that the child needs to isolate from others for 10 days from when their symptoms started, have no fever for at least 24 hours off of any fever reducing medications, and that their other symptoms need to be getting better. In terms of quarantine, if a child is exposed to someone who has COVID, that also is the same recommendations as for adults. 14 days of quarantine if you are an adult or a child who's exposed to someone with COVID. You may have seen some stuff in the news just last week that the CDC provided some guideline changes to provide some other options for a little bit shorter quarantine in certain situations, either a 7-day option or a 10-day option. The important thing to know about those is that those are being given as options just to try and encourage people to do some quarantining. The 14 days is hard for people to do, but the 14 days really is still the best option. So for kids, where typically being at work is not an issue, and being able to put food on the table and stuff is not an issue for the child. For children, if they've been exposed to somebody with COVID-19, they really should quarantine for the full 14 days to reduce the risk of spreading it around in the community and to others, family or friends. How about preventing COVID? So I really want to emphasize this, that we are currently in the midst of another surge of cases here in Central Texas. We are concerned that our hospitals could get overwhelmed if things get further out of control. And we want to do everything that we can to prevent COVID from spreading more rampantly in our community. So masking continues to be of critical importance. Kids 2 years old and older should wear a mask when they're indoors or when they're outdoors and not able to socially distance. Social distancing still extremely important. And a big thing is really limiting contact with other folks, so limiting gatherings, especially indoor gatherings, and being around other people. only doing what's absolutely necessary at this point in time while we have cases surging in our community. And of course, hand hygiene and those types of common sense things. Another thing I want to emphasize with kids is keeping up with their regular care. So it's important for kids to stay up to date with their regular vaccines. We have had a fair amount of drop off in the United States and kids getting their regular vaccines. So that's really important. We want kids to get their regular vaccines, including the flu immunization. So we do have flu immunization available and strongly encourage everybody 6 months old and older to get their flu vaccine this year. All right, so definitely put questions in the chat. We'll get to those in just a few minutes here. I'm gonna switch gears here a little bit and talk about COVID vaccines and provide a little bit of information there. We don't have a ton of information yet. I'll kind of share what I've learned so far and what we kind of know. So there are 3 vaccines that appear to be the first ones coming through the pipeline, and that's what I'm gonna focus on the next few minutes. So there's a vaccine from the company Pfizer, which could get emergency use authorization from the FDA, possibly as early as today or tomorrow. There are hearings going on right now about that today from an advisory group that will provide a recommendation to the FDA in terms of approval. So that's the one that people are talking about potentially being available as soon as next week. The company Moderna has another vaccine that is expected to be submitted to the FDA for consideration potentially as early as next week. There's a third one from a company called AstraZeneca for which there have been some promising initial reports. I'm not entirely clear when that one might get submitted to the FDA, but it seems to be the next one kind of in line. So the first round of vaccines that are available, I just want to mention, are not going to be available for children because children have not been included in these initial studies. So children will be included in studies, and hopefully there will be a vaccine for at least some kids partway through 2021, but we really don't have details about that yet. Pfizer, for their vaccine, has already started to include children 12 years and older in their studies. Moderna is going to be starting to include children 12 years old and older. And that third company, AstraZeneca, has approval to enroll children in their studies, although from what I've read, they haven't started enrolling yet, even though they have approval to do that. So how do these vaccines work and are they effective? So there are lots of vaccines in development. I'm just going to talk about these first 3 that look like they'll be available first. So the vaccines from the first 2 companies I mentioned, Pfizer and Moderna, are something called mRNA vaccines. So these vaccines have the genetic message, and the M in mRNA stands for messenger. They have the genetic message that gives cells instructions for how to make a part of one of the proteins of the COVID virus. So, and that protein is called the spike protein. It's the protein that's on the outer shell of the virus, and that helps the virus attach to our body's cells and enter those cells and infect our cells. So it's the genetic message that gives the cells instructions for how to make that protein. So the vaccine contains that genetic message. It doesn't actually contain the virus itself. It contains a piece of the genetic message. And that vaccine, when it's injected into the arm muscle, that genetic message gets taken up by our cells. The cells use the message, the genetic message in those instructions to make part of the spike protein. And then the genetic material from the vaccine itself is then destroyed by our cells. So it doesn't stick around in the cells. But that genetic message tells our cells how to make that protein or part of that spike protein, which our cells do. And then that part of the spike protein that's made from those instructions gets displayed on the outer portion of our cells. When our immune system then sees that piece of the spike protein on the outer portion of our cells, it sees that it's something foreign and develops an immune response. And it's that immune response that protects us when we then encounter the actual COVID virus. So there are not currently any licensed mRNA, messenger RNA vaccines in the United States, but it's important to know that researchers have studied them for quite some time, from what I've read, even for decades. They've been used to study vaccines for the flu, vaccines for Zika, vaccines for rabies, and vaccines for another virus called cytomegalovirus. So even though there are no commercially available vaccines that use this technology, it is something that researchers are familiar with and have used and have not found any safety issues with. The Pfizer and Moderna vaccines both require 2 doses. They are reported to be about 95% effective in preventing COVID disease, which is fantastic, really pretty amazing, actually. That third vaccine, the AstraZeneca vaccine, is something called a viral vector vaccine. It contains a version of a virus that's harmless and is not able to replicate in humans. Not the COVID virus, but another virus that's sort of in the common cold family. But the virus has been altered so that it can't replicate inside of us. But it does have inside of it some of the genetic material from the COVID virus. So this harmless virus that has some of this genetic material from the COVID virus is in the vaccine, and that's what gets injected into us with the vaccine. And our cells then take up the genetic material that's in that vaccine virus. And then, similar to what happens with the other vaccines, our cells use that genetic material as instructions to make the spike protein from the COVID virus, and it gets displayed on the outer surface of our cells, and then our immune system identifies it as something foreign and develops an immune response, which then provides us with protection. Like with the other vaccines, there are no licensed vaccines in the United States that use this technology, but there are a number of studies with these vaccines, and there is an Ebola vaccine using this technology that is licensed in Europe and has been used in sub-Saharan Africa and areas with Ebola outbreaks. The AstraZeneca vaccine, like the other two, also requires 2 doses. It's been reported overall to be about 70% effective, although when given as a half dose for the first dose and a full dose for the second one, it appears it may be 90% effective. So there's still some data gathering on that. So again, you can put in your questions. We'll get to those in just a second. So who'll be able to get the vaccine? So these first batches of vaccine that we're talking about coming out as early as next week are going to be very limited in amount and are going to go to the highest priority groups, which in Texas have been defined as hospital staff who are working directly with patients who are positive who are at high risk for COVID. In addition, long-term care staff working directly with vulnerable residents. Other folks in this first tier who will be up for getting the earliest doses of vaccine are EMS, emergency medical service providers, home healthcare workers who work with vulnerable and high-risk patients, and residents of long-term care facilities. So those are the folks who are going to be first in line to get the vaccine. PCC is not going to be in the first group to get this vaccine to make it available to our patients, but we are waiting to hear when we will. We anticipate that when the second vaccine, that Moderna one, comes out, that we will probably be in the group that gets that vaccine. So are the vaccines safe? I just want to touch on this really quickly, and then we'll get to questions. So these vaccines have followed all the regulations for testing for safety and efficacy. They have been large clinical trials to look at the efficacy and safety. The trials have included people of different ages, although, like I mentioned, not kids, but folks of different races and ethnicities and folks with different medical conditions. As an example, the Pfizer clinical trials, the large ones, have included over 40,000 people who've each gotten 2 doses of the vaccine and been followed for at least 2 months. In terms of the possibility of serious long-term side effects, honestly, we don't know because people have not used the vaccines for more than a handful of months at this point. But there's lots of monitoring designed around these vaccines so that we will pick up on anything if there are new effects that are found. The data monitoring is by independent experts outside of the vaccine companies themselves, who will be reviewing all of that safety data as it comes in and provide regular safety updates. And I just want to emphasize, we have no reason to think that there will be long-term serious side effects from the vaccines. And I think when you think about vaccines and the side effects and risks, it's important to compare what the other possibility is, which is actually getting COVID. So we know if you get COVID, you have a risk of getting serious illness, you have a risk of death, you have a risk of that long haul COVID where you have symptoms for a long time. And then on the other hand, we've got a vaccine where as far as we know from the data we have at this point, it appears to be safe. And even though there are some side effects from getting it, which I'll mention here in a second, it does not cause COVID, does not cause the illness. So you've sort of got the possibility of getting COVID itself, which we're all at high risk for, versus a vaccine, which appears to be safe and effective at this point. So in terms of side effects, it appears on the Pfizer vaccine, there are local reactions. A lot of people have some pain and some people have some redness and swelling at the injection site. In terms of systemic reactions, kind of whole body types of reactions, things like feeling really tired, headaches, muscle pains, chills, joint pains, fevers, that kind of stuff. The things that seem most common are fatigue, some headache and muscle aches. Fever does seem to occur in a certain chunk of patients who get the vaccine. Vomiting and diarrhea, some, but less so. The side effects seem to be more frequent in younger folks, kind of under 55, compared to folks older than 55. And the side effects appear to be more frequent after the second dose than after the first dose. The side effects seem to occur within a day or two for most people of getting the vaccine, and seem to last a day or so for most folks. So let me move over to questions, and we'll answer some of those. So let's see here. So one question, are there any long-term health effects of children if they get COVID? So I tried to cover that. At this point, there are reports of kids who have some of those long-term COVID, long-haul kind of COVID symptoms, but it does not seem to be very common. Most kids seem to have mild cases and get over it within a week or two, and we just don't have great data. For the MIS, the multi-inflammatory syndrome in children, what ages? So it does tend to be older kids and teenagers, so more that older school age group. And teenagers, again, not a lot of data on that because it's been pretty rare. Another question here. My son-in-law and daughter were COVID positive symptoms. They had loss of smell and taste, headaches, cough, congestion. They have 2 kids and they did not get sick nor were tested. Could they have been positive with no symptoms? They were all together. Definitely possible, definitely possible. So, challenging to know in those situations. This is the type of situation where at some point when we know more about the immune response and how long it lasts and how much protection it gives us if you've had the infection, where it might make sense to do antibody testing, which is not testing for active infection, but testing whether your body has had a response to having been infected. Right now, that's not generally recommended because we don't know a lot about what it means to have antibodies, but it is possible, and at some point in the future, it might make sense for them to be tested for antibodies when we know more about what having antibodies actually means. Can someone be positive again after quarantine? So, the language here is a little bit confusing sometimes. So quarantine officially is when you haven't had the disease, but you've been exposed to someone who's had it. So if you've just been exposed but haven't had the disease, you're definitely susceptible to getting infected. If you've had the disease, if you've been sick, you were tested, you were positive for COVID, so we know that you've had it, then can you get it again? There are cases where people have gotten it again. In general, we think that people probably have protection for at least around 3 months after they've been sick with COVID, and probably aren't at very high risk of getting it again within about 3 months. We don't know too much after that 3-month period, but there have definitely been some cases where people have been sick with COVID, been retested and been clear and been well, and then have gotten sick again and been shown to have COVID again. So getting reinfected is a possibility, although we're not sure how often it happens. Are you concerned about Pfizer's vaccines after reports that in the UK there were 2 cases of severe allergic reaction? Great question. So I think this shows a couple of things. One, there's a lot of monitoring and going on in the United Kingdom. And I should just say, in the United Kingdom, that Pfizer vaccine was approved for distribution. So they're a step ahead of where we are on it. And it has started to be given to the population, the highest risk groups in the United Kingdom. And just in the first days, there were reports that 2 healthcare workers who received it had allergic reactions after receiving the vaccine. Both of those healthcare workers who had those allergic reactions had a history of having severe reactions. They were people who carried around what we would call EpiPens here because they had a history of allergic reactions. So they were more prone to that. So in the UK, they are right now recommending that folks that have a history of severe allergic reactions not get the vaccine. We will see what the recommendations wind up being here in the United States. Right now, they're doing that in the UK as a precaution while they investigate those cases more to see if they really think they were related to the vaccine or not. So I think we'll have to see. But I think it does demonstrate that there's a lot of attention to monitoring for safety, and hopefully anything like that happens, we'll find out about pretty quickly and know about it and know how to inform people about it. Another question, should children who've already had COVID take the vaccine? So that's a great question. We will wait and see what the recommendations are from the CDC. What I've heard folks from the CDC say is that in all likelihood, that they will be recommending that even if you've had COVID and have been positive for COVID in the past, that you will be recommended to get the vaccine as well in all likelihood, but that official recommendation has not come out yet. It is likely that if people have had COVID in the last 3 months, they probably will be a lower priority for getting the COVID vaccine while the supplies are really limited, because we do think that having had the illness does give you some level of protection. Do we know how long immunity against COVID-19 will last after vaccination? We really don't at this point. So that's going to take some time and just following people to see how long. We actually don't know how long it lasts after you've been naturally infected naturally, and we don't know how long the immunity is going to last after vaccination. How young or early can children get the vaccine? Another great question. At this point, the vaccine looks like will not be approved for children at all because it has not been studied in children. So it'll be some time before then. Like I mentioned, the 12-year-old and up group are going to be the first for whom it probably will be approved for in terms of kids, but they're just being added to the studies. Do we know if there'll be certain health conditions in which the COVID-19 would not be recommended? I have not seen anything specific on that yet. I think we'll get good guidance from the FDA and CDC recommendations as part of the approval process. But at this point, I haven't seen details about folks for whom it might not be recommended. For example, in the UK, they're now recommending that if you have a serious allergic reaction that you shouldn't get it. But I don't know if that'll be the case here in the United States. How immune is someone after the first dose of COVID vaccine? That's a great question. And I haven't had a chance to really delve into that and to see if there's good information on that. The most of the people that have been given the vaccine in these first trials have been given the 2 doses. And so we don't really know of the 1 dose. There's another vaccine that is in the sort of highest level of largest level of trials that's going through that is being tested as a 1-dose regimen. That's not one of the 3 that I've talked about. So at this point, really the data we have are on these ones that have been tested for folks with two doses. Cost. This is a great question. Will the vaccine be free or low cost for people without insurance? So from what I have read and understand, that the vaccines will be free for folks, the vaccines themselves, that the places that are giving it will be allowed to charge an administration fee that should be relatively low, and hopefully will be covered by insurance or other payers. But it would just be that potentially that administration fee that would be charged. The vaccine itself is going to be free to folks who receive it. Another question here, and let's see. And my parents' brothers have survived COVID. They're negative now. Is it safe to be together on the holidays since we all have the antibodies? So, this is a good question, and I think it's a little bit challenging and hard to know because we don't have great data about how long people are protected. We do think that if you're within about 3 months of having had the disease, that you do have some degree of protection, but there have been cases of people getting reinfected even within that time frame. But we think that probably if it's within 3 months of having been sick, that you're probably okay, and you probably do have some degree of protection. But beyond the 3 months, hard to know. And certainly if there are folks that haven't been infected, they're certainly at risk. After, it's just a couple more questions here, and I know we're over time, and we'll kind of stop after that. After it's been spread to the first responders or people with higher risk, any idea on when an estimated time the COVID vaccine will be available to the general public? That is a fantastic question. You've probably seen the same things I've had on the news reports, and I don't have further information than that. But I think people are saying probably we're looking at halfway through next year or so, when the supplies are going to get to the point that it's getting more out to the general public. But I don't really know. And last question I've got on here: any indication as to why children seem to get less sick with COVID than adults? That's a great question. There's a lot of speculation about that. Some is that children may have in their cells fewer of the receptors that the COVID virus uses to get into human cells. There's some speculation that perhaps perhaps children have some cross protection from other kinds of coronaviruses that we are exposed to. So there's sort of various speculations about why it might be the case, but not anything that's been really established or proven. So with that, I want to thank everybody for attending our Lunch and Learn. I hope it's been helpful, and I hope everybody has a nice day and a very safe and healthy holiday season. Please take care of yourselves. Remember to wear your mask, socially distance, and avoid those gatherings that you don't need to be a part of. Thanks very much.